Hi guys, Dr. Yalamanchili here. Let's talk about revision rhinoplasty. So in this scenario, someone's already had surgery, but maybe they're unhappy with the appearance of the nose, or maybe they're having difficulty breathing, and so they need to have surgery again. And so in this scenario, it's a little bit more complicated because another surgeon has already created scar tissue, and that happens anytime you have surgery. And so the skin, the soft tissue, the cartilages, everything is already healed down from the previous surgery. So now when we go back in, it's a little bit more difficult because all of the planes have been violated before, and so that's a little bit more challenging than a primary rhinoplasty. The other issue is that usually we take grafts from the septum, so that's in the midline of the nose. We take part of that to help increase tip projection or rotation. And so in a revision rhinoplasty, sometimes there's not enough cartilage that you can use to do what you want to make the changes that you need. And so now you have to look to another part of the body to get cartilage. My preference is to use rib graft. So it's taking a small piece of cartilage from the medial portion of the rib, so about this big, near the center of your chest, and then you can use that cartilage to recreate the nose how you want it to. So that helps you maybe put spreader grafts if someone needs some support here, or tip grafts to change the rotation and the projection of the nose. And so that makes a revision a little bit more complicated because now you've made an incision on another part of the body, and they have to heal that area as well, and then it takes time to do that portion of the procedure. The other issue is that sometimes there's just kind of scarring inside the nose from the previous surgery. So if someone didn't like how their tip looked initially, sometimes there are sutures in there that have changed the shape of it. And once we do that, sometimes things have a harder time going back to the original shape. So you're kind of battling with some of the scar tissue that's happened from the previous surgery. All these things just make it a little bit more complicated than if you were having surgery the first time. Let me know what other questions you have.